Health literacy is about how people find, understand and use health information. It's much more than just being able to read and follow instructions. Health literacy is also about interacting with health professionals, having social support for health, and the motivation and confidence to manage health. Many studies show that low health literacy leads to poor health outcomes, including poorer self-management of health and more hospital admissions. Knowing what sort of health literacy issues your clients face might help you to better support them to look after their health. But in everyday healthcare or community settings, how can you quickly and easily find out about your client's health literacy? One of the ways we can do that is through using the CHAT, or Conversational Health Literacy Assessment tool. This tool is designed to be used as part of the usual intake or assessment process and allows health workers to quickly understand their client's health literacy. It's not a standard questionnaire, but uses a more conversational approach, which has the benefit of building rapport with clients. The chat has 5 sections that cover most aspects of health literacy, with 10 questions in total. We'll go through these in more detail shortly, but one thing to note is that people can do well in one aspect of health literacy and not so well in others. Some people may have a comfortable relationship with their doctor, for example, but actually not understand the instructions that the doctor gives them well enough to be able to look after their health on a daily basis. The chat questions are not a checklist, and you can adapt them to your style of conversation. You don't have to ask the questions exactly as they're written. And it's sometimes easier for clients to understand the questions if they're put into context. For example, if you've already identified that your client finds their medications are confusing, then you can use this as a focus for your questions. And there are some examples of this later. You can ask the questions anywhere in your assessment, either grouped together or as particular issues come up. And if you identify in your assessment that there are other major issues, then understanding your client's health literacy is not a priority at this stage. But if you do need to provide information about this major issue, then consider using TeachBack to make sure the client understands. Section 1 aims to find out whether clients have a healthcare provider they trust and with whom they can discuss all they need to. The 2 questions in this section are, who do you usually see to help you look after your health? And how difficult is it for you to speak with that person about your health? Many people find it hard to talk with health professionals or to ask questions, and this can impact on their ability to understand and use health information. Sometimes people don't like to tell their provider everything because they're not sure of the consequences, or others may not have a regular GP. So for these 2 questions, healthcare providers are not just the GP. Sometimes people have good relationships with others, such as community health staff or practice nurses. And when asking these questions, it's sometimes easier for people if they're put into context. So for example, if the client has already told you that they find it hard to manage their medication, then the question could be framed around that. E.g., do you often ask them questions about your tablets? And you can use additional prompt questions like this to find out more. And if you identify that your client does not have supportive professional relationships, there are some helpful hints in the chat instructions and resources, for example, discussing with their family. Clients with mental health issues or clients from cold backgrounds, culturally and linguistically diverse backgrounds, may also have difficulties talking with providers, and there are some useful resources online or through other supporting services. The 2 questions in section 2 ask about supportive personal relationships with family or friends, people who can be relied upon to provide emotional or practical support for health issues. And this is an important factor for health literacy, not just from practical aspects, but also, for example, having someone to discuss day-to-day health concerns with. As with the other sections, try to put the questions into context for the client, or use prompts such as, how often do you need to ask that person for help with your medication? Where clients don't have good social support, peer support groups might provide emotional benefits, and practical support can often be found through community services. Section 3 is about where clients get their health information from. Are they using reliable sources, and do they understand that information well enough to put it into practice? Health information can come from many different sources, some of which are not reliable. Even when the source is reliable, such as through the GP, clients may not understand it well enough to be able to use it. Remembering that health literacy is about finding, understanding and using health information. So use prompts to find out more and put the questions into context so they're more relevant for the client. There are suggestions in the chat, instructions and resources, and you can emphasise that the GP or other trusted provider is a good person to check information with. This may be particularly important for some cultural groups where health decisions are often made communally, and sometimes advice may not be right for that person. Where people do struggle to understand information, rather than trying to give them skills in this area, your role may be more about trying to tailor the information you give them so they're more likely to understand it. For example, asking how they like to learn information, giving them handwritten notes, or using TeachBack to make sure they do understand. Section 4 is about what the clients actually do to look after their health. The questions are aiming to identify if a client understands information well enough to use it, and also to identify what sort of priority looking after their health is to them. This section elicits exactly what it is that clients aim to do on a regular basis, and then the next section identifies the difficulties and supports that they have in doing so. So for this section, you may find that some of the questions have already been asked as part of your assessment, but you may need to use prompts here to find out more. And where there are difficulties, try to drill down and work out exactly what the issue is. Do they understand what they need to do? Do they need more support? Or are there cognitive or other barriers to managing? And then section 5 is about the difficulties that clients might face when trying to look after their health. It also identifies what supports the client has, as these can often be strengthened. For section 5, prompts to find out more might be, what are some of the things that make it tricky for you to manage your tablets on a day-to-day basis? Similarly to section 4, you may need to drill down more to find out exactly what the barriers are in concrete terms. So if a client says they find it hard to eat a low-salt diet, are there health literacy barriers to this that you might be able to support them with? For example, is it because they don't completely understand what they need to do? And if the client identifies things that support them to look after their health, work out with the client or the family how these supports can be maintained or built upon so they're sustainable and don't wear out. And finally, if you need more information, please contact us on the details shown here. More information can also be found in the chat, instructions and supporting resources available at this email address.